are mycoplasmas. They don't have cell walls. You may have forgotten that, but I talked about that. That might be a good, that might be a test question. I want test questions, right? I talked about mycoplasmas, right? They are the smallest free living organisms. They don't have cell walls. They are pleomorphic. You know why? Because they don't have a cell wall. Cell walls, if you know nothing about bacteria, the reason why they either are coccus or bacillus or Vibrio shaped is because of their cell wall. Literally, it's their cell wall that gives them their shape. So these guys don't have definite shape because what? They don't have a cell wall, right? They're pleomorphic bacteria. Now, ooh, I lied to you. I only said 2, right? I lied. Klebsiella pneumonia. Now, why am I mentioning this with you? Now, the mycoplasma is not gram-negative, it's not gram-positive. It's just mycoplasma, okay? They don't have a cell wall, right? So they're gram-nothing. They don't have a cell wall. Okay, Streptococcus is what? Gram-positive, right? Gram-positive cocci. Here's the deal. If you have pneumonia caused by a gram-negative bacterium, it is very severe. You need to think about why. It's not up on this slide. So right now, if I say if you have pneumonia caused by a gram-negative bacterium, why is that more severe? Think about it. Think about what's so unique about gram-negatives. Okay, the outer membrane, and what do they have that gram-positives don't have? Who remembers? In terms of their cell wall capacity.
Oh, the LPS?
Exactly.
LPS.
They got LPS, which is basically their endotoxin. Exactly right. Exactly right.
Because that makes the lipid A.
Exactly. So, gram-negatives, you're a good student. Gram-negatives, okay, one of the reasons why they're gram-negatives is because they have that outer membrane, peptidoglycan layer, inner membrane layer. They have LPS, right, which is made up of lipid A. Lipid A is an endotoxin. And I talked about that because you remember. Lipid A is an endotoxin, which is bad. And I'll talk about that in a minute. That's why these types of pneumonia are really deadly, okay, compared to the gram-positive version, okay? Now, if you got Klebsiella, here's his name here, Klebsiella pneumonia, he's a gram-negative bacterium, okay? The pneumonia, you have pneumonia symptoms, but it's associated with a very thick, bloody sputum. And that sounds scary, right? Because you can die from that. So you have a very thick, red, bloody sputum coming out, okay? Now, Klebsiella pneumonia, it has a capsule. And we know if you have a capsule, you do what? You hide from the immune system. Okay, so he's very sneaky. More importantly, he has lipid A, that endotoxin. All gram-negatives do. Now, what happens is, when Klebsiella dies in you, because they do die, right? Eventually, they die, they release lipid A, okay? Lipid A can cause shock, for example, causes inflammation, causes fever, causes everything bad, including shock.
When did they die?
Well, just like all other things, they die, so they just die part of their life cycle. So they don't live forever. They grow to a certain point, and then they get too old, and then they die. When they die, that's the point when they release lipid A. Lipid A is an endotoxin, and it causes bad effects in your body, like shock, for example, and that's how you die. Okay? All right, I'm start calling folks out in here. Y'all think I'm crazy, but I'm serious. Okay? Now, who are really at risk? Typically, these types of pneumonias are seen in the hospital. So these are your nosocomial pneumonias, because you see these types in the hospital. Okay? So immunocompromised people, for example, have issues with gram-negative types of pneumonia, like Klebsiella pneumonia. Okay? Oh boy, yes, you can treat them with antibiotics, but the best prevention for you all, because I think you all will be going into healthcare eventually, right? The best way you can prevent your patients from getting infected with gram-negative bacteria that can cause pneumonia is good aseptic technique, right? Basically, washing your hands, right? Because these types of pneumonias found in the hospital, okay? And these types are the most deadly. They are the most deadly because they're gram-negative cause, not gram-positive. They lead to death because they have endotoxin release. Okie dokie. Here's a little picture of Klebsiella pneumoniae. This is probably a capsule stain, right? You see the capsules there? That's why they're so bad, right? They literally hide from your immune system. Everything in white around those cells are what? Little capsules. That's how they hide out. Now, I'm not going to get into this because there's many, many, many different types of cause of pneumonia, right? So we're going to bypass all that. But just know what? Klebsiella, right? Why? It's a gram-negative one, the more deadly versions found in hospitals, okay? No, the mycoplasma one, why? That's the walking pneumonia. And also know what? Pneumococcal pneumonia, got it? That's the most common one seen in adults. Okay, this is a fun one. Not really. This one's bad. Legionnaire's disease. Or basically legionellosis. Okay, now why is this one bad? It typically has pneumonia-like symptoms, okay? But pulmonary function rapidly decreases to a point of basically dying. So it can lead to death. Now, the causative agent is Legionella pneumophilia, causes Legionnaire's disease. Now, real quick history lesson. Why is this one called Legionnaire's disease? Okay, Milton can tell us, probably even Debbie. Not because you're older, it's because you know a lot of information. Now I'm just teasing. Okay. Basically, in 1776, okay, that was the nation's 200th anniversary, okay? Lots of parties going on, okay? So in Philadelphia, you basically had the American, was it Legion people?
American Legion Convention.
Yeah, so the American Legion Convention meeting in Philadelphia for the 4th of July, okay? They go to this hotel in Philly, okay? 200 of them got sick, about 200 people got sick, 29 died. Hit it.
Because they had a closed circuit air conditioning system. It did not bring in fresh air. The old ones used to have water chillers on the roof, and it recirculated air within the building through the water chiller, and it never brought in fresh air. That was the...
Exactly. So that right there.
There wasn't proper filtration.
Right, filtration, right.
So that right there tells you how Legionella is spread. So basically, thank you all, Legionella, my dad told me about that, so I wasn't alive back in that. I was born not too long after that.
I wasn't alive back then either, but you know.
You were, but you knew about it from history books.
Yeah, right.
I was born not too long after that.
Well,
But
halfway to 50, 100.
oh boy. But basically, Legionella lives within water environments. It's ubiquitous in water environments. So it thrives there. Heating of the water doesn't kill it. Chlorination of the water doesn't kill it either. So this is a very tricky bacteria. And you're like, well, why does it hang out in the water? Okay. You can also have protozoans living in the water too. And it was found that Legionella lives within amoeba that's living in the water. So it's not like Legionella is in the water by itself. Legionella lives within amoeba that live in the water. The amoeba end up secreting out vesicles that contain Legionella. These are airborne vesicles. Yeah, it's intracellular. In the amoeba as well as in you. Okay. So the amoeba contain these Legionella bacteria. The amoeba release Legionella in little vesicles. These are airborne vesicles. You literally breathe them in. You breathe them in. Now you have what? Legionnaire's disease, okay? Okie dokie. Now basically, how does it kill you? It basically causes tissue damage in your lungs and inflammation. It basically lives inside of your lungs. It's an intracellular pathogen. So we just talked about this, right? So Legionella lives within domestic water sources. Now, of course, Legionella was around for forever, but people didn't start seeing this disease until people started making AC units, right? Saunas, blah, 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 anything using water. And that thing produces water droplets. That's when people started seeing Legionnaire's disease, okay? So what the AC units in that hotel, basically they refiltered that water. That water was contaminated. And those people, well, 29 of them died. So very, very, very sad disease. Really sad. So who are the most affected here? Elderly, smokers, or immunocompromised, or really at risk. How do you prevent it? So blah, blah, blah. Okay. So you can just control the bacterial presence in the water itself. So use fresh water. If you're using, for example, a humidifier or AC unit, don't recycle the water, basically. Try to use fresh water if you can. Just use fresh water. Recycling the water leads to protozoan growth, for example. You can have Legionella bacteria present in them, and that's how you end up with Legionnaire's disease, and you can die from it. Tabby?
Can you drink out of the hose?
Sure you can. You sure can. I did. I'm still here. It's
I missed
fine.
the beginning, that's why.
You're like, I did too, right?
Check out that food.
Check out the hose. Oh, gosh.
Well,
You can drink out the hose. That's fine. Okie dokie. Now, most of you have heard of this, right? Tuberculosis. these signs of TB are very mild. You may just have some coughing, right? It's very mild. But later on, you can have some very serious symptoms appearing. Now, the causative agent is Mycobacterium tuberculosis. Now, we already know it has that mycolic acid layer, right? Now, that mycolic acid layer helps that bacterium to, survive desiccation, but it also helps that bacterium to survive once it's inside of your body. So basically, we'll get into this, when the macrophages try to eat them, they end up living inside of the macrophages. They literally replicate in the macrophages. Right, the lysosomes cannot attach to them, and they live inside of macrophages, which means they don't die. They replicate in those immune cells. And then they basically form these nodules that you see on x-rays that we'll get into today, okay? All right. Now, basically you can acquire tuberculosis from aerosols, basically from respiratory droplets, is how you acquire it. And there are 3 types of tuberculosis. You've got primary TB, secondary TB, and disseminated TB. Now, I won't define it just yet because I got to go into the pictures first. Once I go into the pictures, I'll then go back and define what's primary, what's secondary, what's disseminated. Make sense? So let's go to the pictures first. Let's do the pictures. Okay. So everything you see here is basically talking about primary TB and secondary TB. Now, primary TB is more common in children. So what's going on here? Okay. So somehow, some way, you inhaled some respiratory droplets from somebody, okay, that had tuberculosis. And they make their way down to your alveoli. Great. Well, waiting for them, again, we've had alveolar macrophages, right? They are there waiting for M. tuberculosis when they get down there. Here's the deal. I just told you M. tuberculosis lives within those macrophages, okay? So that's bad. So you see all these guys here are the mycobacteria, and they're in the macrophage. You see how there's 3 of them in there? They're replicating. Literally, they are replicating in those macrophages. They end up killing the macrophage, right? They get out of the macrophage, and they start the cycle all over again. Now, of course, your immune system, right, they send more macrophages, right, to that area, and you just do the same thing. You have more macrophages, and they end up growing Mycobacterium tuberculosis in them.
Gas on the bottom?
Yeah, pretty much. Now, after a while, you basically have lots and lots and lots of macrophages starting to come to that same area because basically your immune system is telling macrophages, go to this area, right? We have an infection. Go to the area, take care of it. So you end up with lots of macrophages coming to the area. And they start to basically pile up on each other. So basically, you're starting to form that tubercle. Where's that word? Right here. So this is why the disease is called tuberculosis, because you make a tubercle. Make sense? This tubercle is basically the result of the immune system trying to literally wall off Mycobacterium tuberculosis. Make sense? So your immune system is trying to wall off the bacteria. It makes a nodule. That nodule is called a tubercle, and that's why your disease is called what? Tuberculosis. Got it? So everything you see here are basically macrophages pressed in together, literally. They're just pressed in together. They're trying to wall off the bacteria. In other words, keep them quarantined at least, right? Keep them quarantined is what you're doing. Now, in the middle of this tubercle, that's where these guys have been around for a long time. So imagine you start in the middle, right? You got more macrophages coming and adding on, right? Which means everyone in the middle are probably what older macrophages. Make sense? Is that clear so far? Yeah, so everyone in the middle have been there for a while, and the outer ones are the newly added macrophages. Now, in the middle, these guys start dying because they're just old. Okay, they're just old, and at this point, it's called caseous necrosis. You're like, caseous necrosis? Necrosis is what? Cell death, right? That's cell death. So they're dying because they're just old. Okay? Caseous is because when they die, they release fat, and it looks like cheese. Okay? So caseous literally means cheese in Latin. So it's cheese, cell death, literally. So the middle of that tubercle looks like cheese. All right? So that's caseous necrosis. Now, at some point, you basically end up with collagen fibers surrounding that tubercle, and at that point, you're really trying to keep the bacteria in that nodule. And you see that in X-ray. Make sense? That's what you see in the X-ray. You see the walled up area where you had TB growing and macrophages. Now everything up to this point is literally primary tuberculosis, okay? So when you form those nodules, that's primary TB, got it? That's primary. Now what's secondary? As I said, secondary and what? Disseminated. So what's secondary? Secondary is when that nodule ruptures, okay? So sometimes, for example, in immunocompromised people like in HIV, those nodules explode or they open, which means now the TB in that nodule goes to other parts of the lung and they do the same thing. So now you're making new tubercles, correct? So in secondary TB, you're basically making what? New tubercles, make sense? Because the bacteria basically won the war, they got out, and they're going to this bronchiole to do what? The same thing. It's spreading, make sense? So far so good? So primary is mainly seen in children. Secondary and immunocompromised adults like in HIV, they end up with the secondary TB because now the TB is spreading in different parts of their lung. Now I also mentioned what? Disseminated, which means in some cases, the macrophages leave the lung, and they're carrying TB, okay? They leave the lung, and they travel in the lymph, they travel in the blood vessels, and they go to different parts of your body. Now, depending on where they land, they take the TB with them, and it causes disease in that part of your body. That's disseminated. Makes sense? Disseminated, meaning macrophages within the tubercle, they can leave, they can go into that blood vessel there, go somewhere else, and carry TB with it. So now you've got TB in different parts of your body. Yeah, it's possible. So back in the days, no, it is not staying in your lung. So back in the days, in the early 1900s, TB used to be called consumption because it literally consumed the person's body, the whole body. It's like wasting away. So it's called consumption because their body wasted away. Because why? You had what? Disseminated TB. Make sense so far? Okay. Oh, boy. Now, who's most at risk? Immunocompromised are most at risk, okay? And if you have HIV, TB is the leading killer because they end up with what? Secondary tuberculosis, right? Okay, so it's the leading killer among HIV-positive individuals. Now, how do you diagnose it? How do you treat it? How do you prevent it? Okay. Most of you already had a TB skin test done, correct? Yeah, I think all of you had it. At some point in your life, you got that skin test done. You saw a little circle on your arm. And then they waited for about a week or two for a reaction. And most of you probably had a negative result. Good. All right.
What if you haven't had one yet?
That doesn't mean nothing. They used to do it back in the days in school, for example. We all got that little thing on our arm, this little circle, and they wait for a reaction to it. So no worries. You're a new school person.
It just means you've been exposed to it.
Yeah. Hit it fast.
What if a person was vaccinated for TB and then they catch HIV? Are they still at risk of getting it?
Yeah. Because remember, if you have HIV, you have no more T helper cells, which means you do not have a functioning immune system. And as long as you don't have a functioning immune system, you don't have a functioning immune system, whether you have a vaccine or not. Yeah. Okie dokie. Now, Milton, you were talking about this. That skin test basically identifies if you've been exposed to TB or if you've been vaccinated against it. Now, in some countries, people are actually vaccinated against TB. Not in this country. We'll talk about why. So in the UK, for example, people are vaccinated against TB. And if they got that TB, and I'll show you what it looks like. Okay?
Yep.
Yeah, that's a positive result. Now, most of us didn't get that result, right? You just had that circle on your arm and nothing happened, okay? If you were either exposed to TB, either by inhaling droplets or you were vaccinated against it, you would have a positive skin result right there. Remember, it just says you've been exposed to TB. Doesn't mean you have it, right? It doesn't mean you have TB. It means you've been exposed to it, right? So you could be absolutely normal. You could be exposed to TB a long time ago. You will still have the antigens against it. So at that point, what you need to do was the follow-up, right? So if you got a positive skin result, the follow-up is what? An X-ray to see what? Those tubercles, right?
Yes.
And there are some tubercles. So at this point, you know how they form, right? It's those macrophages, right? They're coming in, trying to wall off TB in that little area in your lung. Okay? Now, in primary TB, the tubercles end up in the lower part of your lung. In secondary TB, the tubercles are in the upper regions of your lung. So that's how someone can tell whether you have primary or secondary. So in primary TB, those tubercles will be in the lower parts of your lung. If you have secondary, or basically the ruptured version of TB, those tubercles end up in the upper part of your lung. Really good. Let's go back here. Now, let's say, heaven forbid, you actually had TB. Now, TB is a hard bug to kill, okay? You have to take multiple drugs for at least 2 months, okay? At least 2 months. And you're like, wow, really? Yes, really. Why? Because tuberculosis has that glycolic acid layer, which means it takes a very long time to grow. Now, your most common antibiotics, like all the illins, like penicillin, amoxicillin, it doesn't work against TB because your body ends up clearing the antibiotics out of your system before it even gets to TB because it grows just that slow. So most antibiotics, they are really effective against actively growing bacteria, correct? And TB takes forever to grow, so most antibiotics are not effective against TB. So you have limited options. And those options you got to take for at least 2 months. Here's the deal. Here's another reason why TB is hard to get rid of. You have drug-resistant strains out there, and they are bad bugs. You've got multiple drug-resistant MDR. So MDR is multiple drug-resistant TB, which means it is resistant to 2 of the drugs used to treat it. And you use at least 5 drugs to kill it. 2 of the 5 it's resistant to. That's already kind of bad. Now in XDR, this is extensively, even though extensively is EX, but XDR is extensively drug-resistant TB. It is resistant to 3 or more of your drugs, which is horrible. It's horrible. Hit it.
I noticed here there is not too many hospitals, have because I know in Haiti there are different hospitals, to treat people with TB, and they keep them on quarantine. But recently, I think there is one hospital here at West Palm Beach. There was, I heard, they've been trying to close it. That means all those people who are already at the hospital, we're going to they can be exposed to many other people.
Yeah, TB is actually on the rise in this country. And the sad thing is, none of you are vaccinated against it. You're not.
Maybe we should.
No, I'll tell you why. So in this country, for example, there is a vaccine against TB, but you never got it. It just helps the epidemiologists to track actual cases of TB. Why? How do they look for TB? They do that skin test. That's the first thing they do. They do that skin test. If that skin test comes up positive, it just means you've been exposed to TB. Now, if you've got vaccinated against TB, it will give you that positive result, which means it's a false positive, right?
It's the same as a carrier, right?
You're sort of like a carrier, but the epidemiologists don't care about you, right? They care about the actual TB case. It makes it confusing. So to make it less confusing for them, I don't know why, you all are not vaccinated against TB. You're not. So you can get it. Get it fast.
In my country, as a child, they make you get the TB shot.
Mhm.
Then when I came to the United States, this huge bump
Yeah.
came on my arm, and they
Exactly.
thought,
Yeah.
holy cow, this is positive. But why? I know that the vaccine supposedly carries like something with
Right.
the virus,
Yeah.
but why won't we do it here? I mean, it's a positive thing.
It is a positive thing. So thank you, Faith. Now where
In Cuba, they make you do it. It's
Okay.
mandatory.
Okay, so there you go. So Fanny is describing, for example, in Cuba, she had to get that vaccine. She came to this country, she had to get that TB test,
It came
and
out
she
positive.
got that result. It came up positive, right? But then people are like, oh my gosh, right?
Mm-hmm.
She just had the vaccine, which means she has the antigens against TB, even though you never had it. That's why you had that positive
That's
result.
what the test is for.
Right. Now, in this country, people don't like the false positives. They don't like people like you because it gets them excited for nothing. Literally, it gets them excited for nothing. They see that and they're like, oh my gosh, he has TB. No, you just had the vaccine against it. So really, the only reason why, if you're born in the U.S., you didn't get this vaccine that she got is because they don't like false positives. They only want to see this if you actually have TB and not if you're vaccinated against TB. I'm serious. So depending on the country you were born, you probably got that vaccine.
But can you get it if you ask for it?
That's a good question. I never asked for it. It's available here. It's not like we don't have it. You can try. So when you go see a doctor, just ask for it. See what they tell you. I'm curious. They might say no. I don't know. It's available if you want it. It's available. You may have gotten it in the military, but most common people don't get it. Get it.
Ron, it's you, I'm listening.
That's, yeah.
But I don't understand, how do you get targeted?
Respiratory droplets. So in other words, let's say someone has TB and they're
Oh,
coughing.
so somebody already has.
Someone has it. They're coughing and sneezing, and you breathe in their droplets. That's how you get
I
TB
got you.
from another person. Another person. Okie dokie. Everything else. So here's that vaccine. It's called BCG. By the way, if you want to go to your doctor and say, "Can I have the BCG vaccine?" They may say yes or no. Try it. I don't know what they'll say. But BCG is actually not against TB. It's actually against a TB that causes tuberculosis in cows. So it's attenuated. So basically that BCG vaccine, it has a strain of mycobacterium that causes TB in cows, not in people. It's sort of like the cowpox thing, same difference here. So it's really the cow version of the people TB. It's attenuated, which means it's actually active, it's live. It's weakened, but it's alive. It's weakened, but it's alive, which means if you're immunocompromised, you can't get it. Because you can get the bovine version of TB. Okay? But it's available. It's called BCG. All right? Anything else? Real interestingly, okay, if you ever get TB, what's going to happen is you're going to be put on some drugs, at least 5 of them, for 2 months. But some healthcare person will make sure you take your drugs as prescribed for the whole time. It's just to make sure patients don't misuse their antibiotics. This is why we have MDR and XDR, right? It's misuse or abuse, overuse of what? Antibiotics. That's why we got these strains in the first place. If you ever get TB, somebody's going to be coming to your house and making sure you took your drugs for at least 2 months. Literally. To make sure we have no more of this going on. Pertussis. You're like, for who? Pertussis. Pertussis is AKA whooping cough. You're like, I never heard of that because you all were vaccinated against it, okay? It's called whooping cough. Now, initially, you get cold-like symptoms. And in adults, for example, you never know you have it because it ends up being like a cold. But this is like a pediatric disease. This is a childhood disease. In children, this whooping cough develops. Basically, in whooping cough, you basically go through coughing spells. I mean, violent coughing spells. Violent enough to cause vomiting. Violent enough to burst blood vessels in your eye. I mean, these are violent coughing spells. So it's very, very harsh in children. The cause of it is Bordetella pertussis. Okay, so Bordetella pertussis, gram-negative bacterium. It has numerous virulence factors, but the only one I mentioned here is the pertussis toxin, which is a bad guy. Now, the pertussis toxin is an adhesive, which means it allows the bacteria to adhere to your lower respiratory tract. But it's also a toxin too. So it's like a 2-for-1. This guy's really bad. He has a 2-for-1 protein. It's an adhesion, which allows it to adhere to your cells, but it's also, at the same time, a toxin which kills or inhibits some part of your cell metabolism. Now, think of all the things that can happen in your lower respiratory tract. In other words, the cilia that are supposed to do this, right? They stop working. That's bad, right? Also, those cells make a lot of mucus at the same time. So you see where we're going with this? So right now, you have cells making all this mucus, but the cilia have stopped working, which means you got all this mucus in your lungs. And that's why you end up with all these violent coughing spells, because you know what you're trying to do? Get rid of the mucus, makes sense? And that's why you have very, very, very severe coughing spells. Okay. Now, pertussis has 4 major phases. You got incubation, where basically the bacteria are growing. Okay. You got the catarrhal stage. Now, the catarrhal stage is like the cold-like stage, where you basically have cold-like symptoms. Not too severe, not too severe. But in the paroxysmal stage is where you have the severe case of whooping cough, where you have these coughing spells that are violent. Basically, it's almost like you're choking. You can vomit. And these are children, right? So these are children. They can vomit with all that coughing. They can burst blood vessels in their eyes. Okay, they can stop breathing because they can't breathe when they're coughing like that. They can turn blue. It's very bad in children. And then it ends with the convalescent stage, where you're basically the symptoms decline during convalescence. Right. So the paroxysmal stage, that's where you have those coughing spells because you're trying to get rid of the mucus trapped in your lungs because the cilia have stopped working at that point. Now, pertussis is highly contagious, and as before, you get it through what? Droplets in the air. Now, the symptoms are usually diagnostic. You can look at the sputum and look for the bacteria in your sputum, essentially, to diagnose it. But really, treatment is supportive. So basically, by the time you get to the prophylaxis stage, where you're doing all those coughing spells, you're pretty much on the way to recovery at that point. So at that point, treatment is really supportive. It's supportive. There's no antibiotics given for this. You basically support that child. But the best way to actually prevent pertussis is what? Vaccination, because that's that P in the DTaP vaccine. That P is for pertussis, which means you can actually prevent it altogether. Now, I will say that back in the day, okay, this vaccine used to be called DTP. Literally, it was DTP, okay? That P was actually an attenuated version of pertussis, which means it was the bacterium, but it was weakened, which means children who got that vaccine got sick too. And that's not good if it's pertussis, right? So many parents opted not to get their kids that vaccine, which means if parents got their children vaccinated with DTP, we could have had this disease eradicated, essentially. Because the DTP vaccine was introduced back in the 1940s, I think. So in other words, if parents used that vaccine from the 40s, this disease would have been completely eradicated. It's still around, by the way. Have you seen those commercials? Yeah, it's still around. It's still around. That's why get vaccinated. Get your children vaccinated. It's still around. Now, the A, okay, so now it's DTAP. That A is acellular pertussis, which means it's basically a part of that bacterium. It's not the whole bacterium. So it's acellular pertussis. So it's safer than the older vaccine, which was DTP. DTP.
That's a subunit.
Yeah, it's like a subunit of that bacterium. So it's acellular pertussis. So that's the AP in DTAP. Okie dokie. Oh boy, I got 1 minute. I'm sad for you. Okie dokie. Here is Bordetella pertussis growing along those cells. You see those cilia? Those cilia will stop working because of that dye. Which means if they stop doing that, right, they can't get rid of all the mucus, and they also cause building up in your lungs. And you end up with that whooping cough. Here's the last one. You're like, oh gosh, I heard of that one, right? Yes, you have. Inhalational anthrax. Okay, most of you were alive back in 01, right? Yeah, okay, back in 01 you were alive. Debbie says no, she wasn't around. But you know, back in 01, there was a bioterrorism scare, correct? That somebody was mailing anthrax spores in envelopes, right? And many people got exposed to anthrax, and some of them died. Now, a lot of those people ended up with the cutaneous version, which means they got the endospores on their hands, which is not a bad disease to have. You basically have lesions in your hands. You can live with a lesion. Doesn't look nice, but you survive, okay? You live with that. Here's the deal. If you actually inhale those endospores, your mortality rate is about 50%. You want to be in that ratio? No. That's scary, okay? Now, the initial symptoms resembles the flu, the cold or the flu, but then it progressed to severe coughing, lethargy, shock, and death. Literally 50% mortality rate here, so that's not good to have. Here is a causative agent, Bacillus anthracis, right? Gram-positive, and it forms endospores, right? So that's why he's special. He makes those endospores, which are bad for you. Were you alive?
He was 96.
Okay, you're alive. Remember that? Scared? Anthrax?
You remember?
Never heard of it.
Yeah. Yeah, that's what we're talking about right now. Oh, no.
And you like seven.
What? all kind of stories. Okay. Here are your virulence factors. Okay. First of all, you breathe in the endospores, okay, from some damaged male, okay? You open some male endospores, you breathe them in. At that point, when those endospores make it to your lungs, those endospores germinate, and they become the vegetative cell, meaning the actual bacteria. At that point, Bacillus anthracis makes a capsule. Which means what? It's going to do what? Hide from your immune system. Hide from your immune system. And it also makes anthrax toxin. So anthrax toxin is all these bad things here. Look, it's the anthrax toxin itself. Now, luckily, anthrax is not spread from person to person. So you cannot get it from your neighbor. It doesn't happen that way. You literally have to breathe in endospores. Now, mine is bioterrorism. You can be exposed to endospores from the soil because Bacillus lives in the soil. So you get it from the soil or from animals, okay? So that's how you naturally acquire it, but unfortunately some people have used it for a bad way and put it in envelopes, okay? That's not the natural way to get these guys. Okay. Now, how do you treat it? Okay. If you got exposed to anthrax, you got to get to the hospital immediately. Early and aggressive treatment is not enough. You got to get early treatment and aggressive treatment. But you also got to get your lungs cleared out, literally. You got to do all of that just to make sure you survive. Because antibiotics is not enough. Even if you're on drugs, you still can die. So you have to have early and very aggressive treatment where they literally get the fluid out of your lungs so that you can make it.
What would they do? Jump a respirator to pull it all out?
Exactly. They got to pull it out constantly to help you make it through anthrax. There is a vaccine available, again, to select people. So you don't have the vaccine. But if you're one of those select few, you may get the TB vaccine and you can get anthrax too. Most likely in the government you can get that. But if you're normal like us, you don't get it. So hopefully no one else tries to do that endospore and envelope ever again. Because again, if you breathe it in, 50% mortality, literally. 50%.
They don't do the anthrax for the healthcare workers?
No, I think it's really for government workers. But ask for it, you never know.
Do you think
Just
that,
curiosity, what they did with it.
Yeah, exactly. But again, it's not person to person.
That's right.
You have to actually breathe in the endospores. You got to breathe it in. Hit it.
do the mail places have to get that now?
Probably. But my mom works for the post office. She never got that vaccine. But they should. Okay, here's the deal. Oh, look at that. I'm going to let you go. But look at that. Is that a hospital? That's a gym. That's a gym.
That's a bunch of issues.
That's a gym. Luckily, none of us were around in 1918 and 1919. That was an influenza pandemic. Literally, you could be in a city and 10,000 people in your city in a week will die. So you imagine you're in a city and every week 10,000 people died from the flu.
It's depopulation.
In this era, half of the world's population had that flu virus. Half. It was a pandemic, literally.
Is there any vaccines for
The flu?
for the influenza?
Yeah. Get it every year. But I can't tell you right now, because this is real good stuff, right? I can't tell you the good stuff, right? I can't tell you why you get it every year and why.
We get to it.
We're going to get to it next week, right? Because we'll talk about this and why you got to get the flu shot every single year. And why every 10 years you end up with those lethal pandemics. That's next week.
Does it have to do with their capsules changing or protein codes changing? Or
Sort of. It's something with their outside changing. And every 10 years you get a pandemic. That's next week, though. That's next week. I know it's good stuff, but
Never had the flu
So it could be preempted, right?
Never. I've heard that they
Sonia's like, I got to go.
I'm awake.
She's like, y'all talking too much. Happy Thanksgiving, Sonia. She's like, y'all talking too much for me. Go ahead. I'm listening to you. Have a question. If you want to go, you're just going to have Thanksgiving.
She's starving.
You're just
She's
fortunate.
starving.
Have you ever had the flu? Like,